Hello, my name is Dennis Scanlon, and I'm the Director of the Center for Healthcare Policy Research at Penn State University. Today, we engage in another session of Ask the Experts, where we'll be talking about training the next generation of medical students, the next generation of physicians who will serve our country for years to come. And I'm delighted to have with me two guests from Penn State, Dr. Dr. Wong, who is the Associate Dean for Medical Education at the University Park Regional Campus of the Penn State College of Medicine, and Morgan Decker, Medical Student Design Partner, University Park Regional Campus of the Penn State College of Medicine. So welcome to you both, and thanks for joining me. So I'm excited about this topic today. We're going to be talking about a new model for training the next generation of physicians. And I guess if we talk about a new model, it implies that perhaps the old model isn't quite working, or maybe it needs tweaked a little bit. So Dr. Wong, maybe I could start with you and tell us a little bit about the background and this new medical education program that you've developed and why it's new.
Well, thanks, Dennis. The thought behind putting together a new educational program stemmed from the notion that the way doctors practice in the 21st century is vastly different than the way they had been practicing in the previous century. And the way that medicine has changed in the past decade even is remarkable. Some of the skills that students need to have include working within interdisciplinary teams. They need to be able to access the information that is so readily attainable, but also be able to separate out that information that is helpful and that is not so helpful, and be able to use that for their own decision-making capacities. And all of those things have really led us to where we are now.
Mm-hmm. So what was the impetus? Why Penn State? This could be happening in a number of places, and perhaps others are trying something similar, but why did Penn State decide to do this?
I think you're correct. There are a lot of different medical schools that are trying to rethink the way we teach medical education. I think the educational leadership at Penn State College of Medicine has been very forward-thinking. The whole premise for doing this was actually based on a model from the Olin College of Engineering, wherein they used students to help design their curriculum and devised a curriculum that was very experiential. Penn State, in a meeting with the AAMC, the Association of American Medical Colleges, and the American Medical Association, sponsored what they called an educational summit in Washington, D.C., and brought thought leaders from all over North America to come and really grapple with this issue on how we should train medical students for the future. And it was from that meeting that a lot of the ideas have been implemented on this campus. So I don't know why Penn State, but we're very fortunate to have them and be part of that.
Great. Now, is there some funding associated with this program as well, some external sponsorship?
There is. Senator Jake Corman here in the central part of Pennsylvania was able to be thinking about how we can create more physicians for the center part of Pennsylvania. And his ability to bring in some money to support this campus has been really instrumental in helping us to do that.
Great, great.